Yeah. All right, so we're here with the brave, beautiful Miss Mackenzie. She's 5, and she has her beautiful clovers on today. She's all set up for St. Patrick's Day. She looked absolutely cute and adorable in her whole getup. So she's here to get checked out for chiropractic. Her mom brought her in for a wellness journey towards health. So she has idiopathic rheumatoid arthritis, right?
Yes.
So she was diagnosed age
18 months old.
18 months old, and she's been on medication for a few years.
Since
right?
18 months old.
Since 18 months old. She was on Enbrel.
And she was first put on methotrexate. She was on methotrexate for about 3 months with no change to her symptoms. Her right knee and her left ankle were so swollen to the point that she couldn't walk. After 3 months of no change on the methotrexate, her rheumatologist added Enbrel. She was on Enbrel and methotrexate for a full year together, each an injection in the leg, which we had to do at home, where Dad physically had to restrain her, and I had to give her the needle at home. It was traumatic for everyone involved. After a year on the 2 medications and no new flare-ups, we asked that she be taken off the methotrexate and see if she was good with just the Enbrel. So then she was on the Enbrel alone for another year, a year and a couple months. But still, weekly injections, Dad having to physically restrain her, Mom having to suck up the tears and physically hurt my daughter for helping her. And I told her rheumatologist from day one that I felt like we were only treating symptoms, not the cause. So she's currently completely off all of her medication, and now our goal is to get our bodies in tune so that we don't have any new flare-ups, so we can stay off of these medications.
Cool. So I love that approach. I love the root cause. I love the cause aspect of it. We did a food sensitivity test on her to look at some of the underlying triggers that could be leading to or contributing to autoimmunity or inflammation or pain. It's true for everybody that a lot of people with autoimmune conditions have food sensitivities. So we want to look at those. So we're waiting for those results. We haven't gotten them yet. And we're going to do a spinal evaluation today, check out her nerve system, as we call it, for people that might not be familiar with chiropractic. The spine is our lifeline. It controls and coordinates every aspect of our life. Messages get sent from the brain, down the spine, down our arms and legs for movement, for sensory, for feel, and then from the brain all the way to our organs. And so it controls that. Any part of the spine that has misaligned or there's a problem in there, we call it a subluxation. It can interfere with those messages getting through and just affect how our body functions and heals. So we're going to check out Miss Mackenzie's spine. This is a harmless test. The first one's going to read heat patterns off of her spine to see any abnormalities in the nerve system, or stress, as we call it, in the nerve system. And then the other one's going to be a muscle test to see what kind of tension she has in her muscles. And yes, even at 5, they can have tension in muscles. You see how they play. Do they wrestle each other or
Absolutely.
put each other in headlocks or anything like that?
Well, not yet, but they do like to do nosedives off the couch.
See, those things can create spinal problems. So Mackenzie's being really brave. She's here and she's being really kind and brave and allowing us to film this. So first thing, I'm just going to create some marks on her spine. Mackenzie, this might be really ticklish. Your job is to try not to be so ticklish and move and squirm. You're going to try and be really still.
I'm going to put on the lion guard for you to watch and not laugh, okay? And not jump around, because Dr. Dave needs you to hold still.
What are we watching?
The lion guard.
The lion guard.
I love the lion.
S1.
So you're going to sit up nice and tall.
Nice
and
and tall.
Mackenzie, this
I love the
might
lion
tickle.
guard.
So our job is to try and sit up really tall and not laugh or squirm, okay? Or move.
Just like when we have to go for blood work, I want you to focus on the lion guard and let Dr. Dave
T1.
work on your back. You're doing such a good job.
That's awesome.
Focus on the lion guard.
C2.
Good job.
Left C1.
Okay, I'm going to go right behind your left ear. I'm going to keep looking straight over there.
Look over at the lion guard. Good job.
Right C1.
One more. Wow, they're doing awesome. Isn't this easy? Easiest doctor's office ever. And non-traumatic.
That's what we're going for. Less trauma in this poor child's life.
So these scans, like these colors, are areas of stress in her nerve system, tension in the nerves. And where you see colors are areas of problems. So green would be mild, blue is moderate, red is severe. So she has a lot of pressure up here in her upper neck, in her neck region, and in her mid-back. Those relate to different spine areas. So here's a spine chart. Different areas, for instance, upper neck region, people have that. It can create headaches, migraines, nervousness, difficulty sleeping, anxiety, depression, when you're older, hormonal or menstrual issues, digestion. Upper neck plays a role in digestion, vagus nerve into the digestive tract is kind of advanced. Anyway, just going to give you an idea of how that is affecting how her body's working. So it reads infrared. It's reading heat patterns off of the spine, off of the nervous system. That was awesome. You did great. One more. You think you can handle one more? So these things, they look really big and mean, but they're really not. All I'm going to do is just put these on different parts of your back, okay? And we're going to go down like this. And you're just going to try and be really still like you did the first time.
Okay, and I put the line guard back on for you.
Can you pause it?
Pause it.
I know.
I never heard of the Lion Guard.
This is a new generation Lion King for the kids.
This is going to be chilly, Mackenzie. I'm just going to clean your skin, okay?
So Mackenzie, just like when we do Bad Boo Boo Day at home, Mommy has to use alcohol to clean your skin, right? So Dr. Dave is not giving you any bad boo-boos, not at all, okay? But he's got to clean your skin off just like we have to for Bad Boo Boo Day. So that's what he's doing right now, okay? He's cleaning your skin so that this test can read properly.
You said that perfectly, Mom.
Mom, that one is
All right, Miss Mackenzie. This is going to be another easy test. You're going to try not to laugh, okay?
You're doing so good, sweetheart.
You are. You're doing awesome. And you just turned 5, right? Not too long ago?
About a month ago. Not even a full month.
So is 5 different than 4?
Begin scan.
Do you feel bigger
C1.
at 5?
You have to hold up more fingers.
Actually, can you move that more over here so she's not turning her head as much? Good job. You're doing great, Mackenzie. This is as good as it gets.
C3.
So what these things are reading is actually reading tension in the muscles. It reads it by electrical current. So if there's tension in the muscles, this is going to pick it up. But their necks are kind of tiny compared to adults, so sometimes up here it's hard to get a reading real quick.
C5.
I know this isn't really exciting right now, but hang in there. But the people can get entertained by the cartoon, so. Make sure you get the cartoon in the video so they have something to
It's
enjoy
there.
themselves.
C7. T1. T2.
Mackenzie, you're doing great. Isn't this pretty easy?
T4.
She's busy watching her show. You just
No,
keep
she's
doing
wa-
what you're doing.
She's watching the screen up top. She wants to see what Dr. Dave's looking at.
Do you know all the characters on that?
Use your words, babe.
Yeah.
Yes. All right.
We like to play line guard at home, right? Who are you?
I'm fully.
You're fully.
You're the running guy. Daddy.
Who's your favorite?
And Mommy's
character?
going on.
You sit up nice and tall.
David's
Awesome.
gonna-
See that great posture.
This is Dave. This is Queen. Queen Nala.
Queen Nala. What about Queen Nala? No, sit up nice and straight for Dr. Dave. I know, it takes a lot of muscles and
It does.
concentration to sit up straight.
And who's gonna be
Also good
older?
posture, which you don't see with kids anymore in technology.
T6.
You all right over there? You're okay.
T8.
Poor. Everyone will say every bruise on her body is related to mom.
Oops, don't pull on that, Kaylee. You'll have your turn too.
T10.
Maybe Dr. Dave can help your sinuses.
Yes, that would be the next thing.
T12.
Oops.
We used to have these really nice gowns. Now they give us these oversized napkin-like things.
Yeah, you really could cut it up into pieces and use it as a napkin.
I think the kids' ones are fantastic with the cat in the hat on them. Even if they're a little flimsy.
Yeah, they just rip really bad in the shoulders
L3.
real quick. But that's alright.
You're almost done, Mackenzie. We got three more little bones to check.
L5.
She's doing really good.
Mm-hmm.
S1.
This poor kid, she's been poked and prodded her entire life.
I
She's
was
gotten
gonna say.
very good at sitting still for doctor's appointments.
Chiropractic is probably going to be like
It's gonna be like going on a field trip every day. Every time she comes.
So I was looking at stress in her muscles, and she's got quite a bit of tension in her muscles, but a lot of kids do, believe it or not, and we don't think that they do, but that's where some of these issues start, is when they're young.
I have a question for you because
Sure.
it completely escaped my mind. Mackenzie broke her collarbone.
Yeah.
Ah,
This is
She
both
was jumping on the couch and went right over the back of the couch and landed square on her head.
oh,
At first, I was afraid she broke her neck. Could that
yeah,
injury, could she still have
absolutely.
muscle tension or?
Yeah, that makes sense because her first scan, the nervous system scan, she was showing a lot of stress in her upper neck. But you get hit on the head like that, that's pretty traumatic.
Yeah.
But that can manifest later or down the road because those stresses, if not released, they grow with those. And that'll create imbalances in muscles, it'll create imbalances in nervous system, it'll affect how her body manages stress. So, like she's having, this is another handheld instrument, and so this is gonna hone in a little bit more specific on where her misalignments are, where that scope comes back. Reading right there is a pretty big reading. So that's T7. She's got some activity in the lower mid back too. Like right there.
Now I know you said it's normal for kids to have
L1.
muscle tension. I'm so sorry.
No, you're good. You can.
Is there?
Common, not normal.
My apologies.
No, yeah, no, it's no, because yeah, even for people they think, oh, it's just normal to have X, Y, and Z, normal headaches, normal muscle tension, normal whatever, and there's nothing really normal about that. It's just common.
Right.
Yeah, I'm sorry, go ahead.
Nope. No, you're right. Is there a common, whatever the numbers are that you see, is
Right,
there a
common.
common or a median that you see with kids versus adults?
Yeah, like common misalignment areas.
Yes.
Yeah, upper neck and pelvis.
Okay.
Yeah. And then usually something middle back, but usually the upper neck and pelvic area, like in the ilium or sacrum, most common, and then upper neck region
Okay.
are the biggest problems. And she was an emergency C-section, I read in here.
Yes.
So tell us about that.
While I was in labor, her heart rate had dropped a couple of times. The nurses had me flipping all over the bed, trying to get my heart rate up and my activity level up to raise her heart rate, which worked a couple of times. But by the third time, her heart rate dropped. My OB said, enough's enough, it's time to take her out before there's any kind of serious damage from her heart rate dropping like this.
Okay. Now, like a C-section delivery is more traumatic on the spine because there's a lot more pulling and torquing of the neck. I always want to say torquing, make sure it's twerking, not twerking. Pulling of the neck. So there's a lot of pulling, torquing, and that too can create a lot of stress. I say, picture a newborn being born, and then we put the newborn on the ground, and I pull it on, drag it by its head along the ground. Someone would be upset about that. We don't think about that in the delivery. There's a lot of pulling and pressure on the neck region too. So that can create upper neck, followed by trauma, breaking a clavicle and landing on your head. That's another one. They just bounce up and keep going, at some point. But those things do create problems down the road.
Right.
And that's what this is showing, manifesting now. So she's got a right sacrum that's not moving, right? So she's a right sacrum problem, T7L1 showing up in her spine. And it feels like she's got all right-sided stuff.
That makes sense. She is right-sided, and the right side is where she's had most of her injuries.
Yeah, like her upper neck, her atlas on the right side is...
So Kenzie, loosey-goosey, let Dr. Dave move you just like we let Dr. Lerman move your legs and your arms. We're gonna let Dr. Dave move your back and your neck, okay? Loosey-goosey.
You did good loosey-goosey. I'm gonna take this hand and pop you on the head with it, okay?
Like little bunny foo-foo?
Do you remember which shoulder was fractured? It feels
Her
like
right.
the right one.
Her
Yeah.
right.
So there's a restriction in her right shoulder. We got some repairs to do on this little one.
Hey, why are you tying yourself up?
Are you still there?
Yeah.
Okay, just making sure you're still there.
So, Dr. Dave, I have a
All right.
question with the shoulder. What is the prognosis on a child, getting a good recovery from an injury like that? So, because she's so young and still growing and things aren't where they're supposed to be as opposed to an adult.
I say better, their bodies heal pretty well when they're younger. And as long as was she casted in a sling? Like
She was in a sling.
in a sling. As long as it healed well and it healed without major problems, the prognosis is good. But again, coupled with like a right neck issue, a right shoulder issue, a right pelvic issue, her whole right side's contracted down. So again, that can create distortions in her body later on as she grows and develops.
Right. So an adult with an injury like that you would see at, maybe Amy's age, mom, may not be as...
Will manifest as a pelvic tilt and rotation.
Okay.
Will manifest as arthritis,
Okay.
disc degeneration, pain. Like that's the progression of it down the road.
Okay, just curious.
Yeah. So we're gonna transition out. We're gonna end this part, and then we're gonna go adjust this little one, and we'll show you that too. Okay.
Okay, 1, 2, 3.
Okay, we're back. We just did an exam on Mackenzie. Found out that she had subluxations or problems in her spine at upper neck on the right side, C1, T7, L1, and her right sacrum. I might not address all those in one visit today, but I might probably do the C1 and the sacrum first, and then we'll see what happens on the other ones. So Mackenzie, I'm gonna start working on your spine, okay?
Okay.
When I start working on your spine, you're gonna hear popping noises like popcorn, like pop pop. So I don't want you to get scared. All that is air. It's not actually things popping or cracking. So it sounds like a crack noise and a pop noise, like popcorn, but don't focus on the noise. All right? And if anything I do bothers you, just let me know. Let me know if it hurts, or let me know if there's a problem. You might feel, I don't know, it's gonna be different. A different kind of doctor's visit than you had. Hopefully it's gonna be really fun and exciting for you. All right?
Are you nervous? Are you excited?
I see like the eye crinkles of smile under there, you know?
Yes.
Okay, so actually we're gonna go for a ride first. We're gonna go to this table.
Okay.
Now, we scoped her in the other room. Usually I'll do the scope, but we just did that in the other room. So Mackenzie's, you've probably seen Mom and Dad go on this thing?
Yeah.
Okay, so you're gonna just hang on. I'm gonna lower this table, and your job is to just hang on, all right? All right. This is exciting. She's so color coordinated today. So we're gonna go all the way up there. We're gonna fly up there, Supergirl. You're gonna put your face right in where that hole is. Put your nose down there. Right there. And your hands can go here. I'm gonna move you up just a little more. Mackenzie, if you can't breathe with that mask on, is it okay she lowers it?
Yes.
Okay, if you can't breathe with that down there, you can take that down, okay?
There you go.
We don't want you passing out on us. All right, I'm gonna come down this side. All right, Mackenzie, you're going to feel me kind of lean into you. You're gonna feel me squish you down, okay? I'm gonna squish you down, and you're gonna try and be really relaxed. You're doing really good. Nice job. Feel all those popping? All those little pops, that was just air. You okay?
Yeah.
Okay, good job. I had to squish you down a little bit. So I'm gonna check this little one's knees too. And it feels like her right fibula head is not moving right. All right, Mackenzie, I have this little instrument in my hand. It looks like this, okay? I'm gonna do it on myself. It doesn't hurt. Let me do it on your finger so you know what it feels like. Is that bad?
No.
Okay, I'm gonna use that right on your knee, okay? Okay? Okay, good. So this is just trying to get her fibula head moving. Good job. All right, so I'm gonna have you turn over. Can you turn over on your back, please? And we can see your awesome outfit. Look at this cute thing. Luck favors the kind. So I'm just checking her knees this way too. Same thing, okay? How adorable. Do you do any dance? Do you do gymnastics? Do you do anything like
I
that?
do dance class.
You do dance class?
Yeah. And I got on fire 2 days ago.
So this is gonna make you dance better.
He didn't even hear her. Did you hear? Her
Her
dance studio caught fire.
Oh my goodness,
The whole studio's gone.
Oh no.
The building
Yeah.
is still standing, but the 3 studio rooms, my understanding is those need some TLC before we can get back in there.
Oh no. So you're just gonna have to dance at home with mom.
We
You're
do
gonna have
dance
to.
parties?
You have to have your own dance party. What kind of dance do you do?
Do you do ballet?
Yeah.
And what other?
Mommy, I love you.
Do you remember what it's called?
Sweet thing.
Sweet dance. You do tap and jazz and ballet?
Yeah.
Yeah? And we just started,
Sweet
right?
dance. That's the last thing we do and then we go home.
Oh, freeze dance.
You might hear some popping in your toes. Hear all those popping in your toes? This is gonna make you dance bigger and better and more balanced. Good job. The table's gonna come up, okay? So you go for a ride. Hang on. You're gonna slide down a little bit. There you go. We're gonna go to this table.
Okay.
Hold on 1 second, Ken.
Okay, so you're going to put your head right here and your shoulder here. We're going to lay on your side, okay? Good job. We're gonna bend this top leg. I'm going to bring you closer to me. I'm not gonna drop you on the floor, okay? And if I do, I promise I'll pick you up.
Okay.
All right, but I haven't dropped anyone at all yet.
Yeah.
Okay.
I'm good at guessing myself.
You're good at catching yourself? Okay, Mackenzie.
Not all the time.
Not all the time. I'm gonna work on this part, her right sacrum. So I'm going to lean on you again, kind of squish you down, and you're gonna hear some popping noises. Good job.
I heard that.
Nice job.
That was beautiful.
We're gonna go back to that chair, okay?
Beautiful audible. I love that word, audible.
Scott!
Good job, Ken.
Are you losing your drawers? Losing your shamrocks? Tracking these shoulders, especially this one. Does she sleep good?
Mackenzie? Yes.
Oh, but all the days when I watch TV all night, I stay up all night.
You watch TV all night?
She tries to.
What kind of shows do you watch all night?
I watch all of them until the morning.
You watch all until the morning?
Yep.
Oh my goodness. Sounds like Dr. Dave. All right, Miss Mackenzie, you're going to lean back into the chair, right?
And relax.
And relax.
Loosey
So
goosey.
I'm going to push up here right behind your ear, okay? You know those popping noises you heard there?
Yeah.
You're going to hear it right behind your ear.
Mm.
So we're going to tilt your head this way, and I'm going to be pushing that way. Good job.
Well done, kiddo.
Nice job.
Okay, loosey goosey, let Dr. Dave do it.
Actually, I'm going to take this back down so I can... Nice job, Miss Mackenzie. You got one more in you? You think you could do one more?
Yeah.
I think you can too. Feel a little C2 on the left. Okay, we're going to do it this way this time. So we're going to tilt your head to the left this way. You're going to put your hands in your lap. There you go. I'm pushing that way. Okay. Let me check your little wrists and fingers out. She's doing really good.
Fabulous.
Your job is to remember to sit up nice and tall. Okay? All the time.
This is more proof that kids know what's good
Even
for
for
them.
Miss Kim. Tell Miss Kim, see my perfect posture?
Say hi, Miss Kim.
I was gonna.
Well, be at school as soon as this is over.
Do you know after this I'm going to school?
You are? Are you gonna have fun there?
Yeah.
All right.
I might be full of playtime.
Oh my
You might get there before playtime? Okay, well then we should probably all say goodbye then, huh?
You did great. Give me 5. Awesome.
Good job.